Going live in 3, 2, 1. Okay. Good evening and welcome to this another episode of Wednesday Musing. We are very happy to be back after a break of a week, and we are looking forward to this episode where we are going to discuss the future of orthopedic surgery and the careers in it. So, over to our moderator, Dr. Taran.
Yeah. Hello, everyone. Welcome back, Borate sir. Welcome back, Ashok
Yes.
Shyam.
Good evening.
So we have conducted approximately a good number of our Wednesday musings, and I realized a peculiarity about our meets that in our earlier meets, we superficially just touched upon certain topics. For example, in our meet of reforms in orthopedic training, we touched upon the future of orthopedic training as in simulation. But as our meets are progressing, we are dwelling upon certain topics which we discussed earlier. That brings me to our today's topic, that is the future of orthopedics surgery and practice as well. So today we'll be discussing with Borate sir very interesting topics, like right from virtual 3D surgery planning to tissue engineered biologics to telemedicine to simulation techniques and the works.
Just excuse me 1 minute. I'll just come 1 second.
Sure, sir. Sure.
You can go ahead, Taran. You can introduce the topic.
Yeah. So like I just mentioned, initially when we started the Wednesday musings, we touched upon a certain topics, and as our meets are progressing, we are dwelling upon the details of the topics which we just mentioned in our previous meets. That could be, for an example, the future of orthopedic trainings could be simulation. And today we are going to discuss that. Today, sir, is the 13th meet, probably 13th or 14th meet.
Yeah, it is the 13th one.
Yeah. So after so many extensively comprehensive and exhaustive meets, we will be discussing. Now we have come to the pinnacle, and we are discussing the future of orthopedic surgery and orthopedic practice. So we'll be discussing about right from robotics, futuristic implants, and virtual reality, simulation, etc., etc. So to start with, Borate sir, you have to unmute yourself, Borate sir.
Yeah.
Yeah.
Okay.
So I just gave as an opening note, I just gave an introduction of our today's meet. So to start with the future of orthopedics.
Yes.
We'll come back to later to the practice and patient care as well. But what about the future of orthopedic surgery, to be precise?
Yes, I think, these are very exciting period in our orthopedic surgery evolution, because although we have had a significant impact of technology on the way we were doing surgeries and the way we were using equipment and so on and so forth. But we were till now trying to do what we were doing before better, But now the certain technologies which were in experimentation have now started appearing into the practice, in the field of practice and surgery. Like, for example, virtual 3D printing is now becoming more and more easily available, and it is becoming a very efficient and effective tool for making anything that is specific to the patient. So if it's an implant like a plate or a nail, or even and something that we need to increase the adaptability of the device, all that can be done very efficiently nowadays with virtual 3D printing, and we are going to see more and more of it being used. So you won't have like an inventory of implants. Moment you want to do something, you will just pass it on to the 3D printing workshop, and you will get exactly what you want, and that's exactly what will be put. So that's what is likely to happen. Need to excuse myself for a second.
Yes, like Borate sir mentioned about 3D
Sorry, yeah,
printing.
I'm back.
Yeah, so I was just adding up to the point of 3D printing or virtual mapping.
Yeah.
Like in severe pediatric hip reconstructions, or not really pediatric, wherever you need reconstruction of the joint, a custom made implant is of utmost importance, and the 3D mapping really helps.
Yeah. So see, the thing is, we were thinking of this as something exotic, but now, it's going to be more and more used, and it will become part of what we are doing with regular patients as well. Now, for example, the use of magnetic growing rods. So after you corrected a deformity in a child and you want to hold that correction, and you know that as the child grows, whatever is holding or the rod, it needs to get longer and longer.
Right.
So this will be now done without any intervention, by just using the magnetic tools
Yeah.
to accomplish what we want.
Yeah.
And see, robotics also has been talked about, but now we will be using robotics in various ways. We used to only think of the robot as somebody who will do the operation better than us, like somebody who will take the cut better or whatever. Now, the robot is going to do a lot of things that are uh, part of the surgery. For example, you may have robots that will assist you in surgery. You may have robots which are trained to retract and give you good exposure at various steps in the surgery. So they will be like virtual assistants, or they'll be your assistant. Robots will also make decisions for you. So they'll not only implement decisions, but they may be useful in making decisions at various steps in the operation. So the whole use of robotics is, as it is becoming more widespread in various aspects of science and various fields of professions like engineering and other fields. In the same way now, it is becoming more and more widespread, and we are discovering various newer ways in which robotics will make uh, surgery and its practice different. There's a huge explosion of research into trying to create new biological material, like cells, like, uh, plasma, like blood, like, various natural substances and things that uh, will be uh, more and more useful in healing. For example, I don't know if you know this, but for many years we have been told, and we have been very excited with the idea that we will be able to develop a biological glue someday, in which all we have to do is kind of hold the bone in a reduced position and inject that glue around the broken bone and let that glue set. And now you have a bone fracture that is instantly stabilized and healed with a biological substance. And all one has to do is wait for the natural healing to replace the biological substance. And then you will, so that's all that is needed. So you won't need a metallic implant or something
Sure,
which
sure.
has,
We do have biological suturing material right now as of for smaller wounds in kids, and
yes,
for
yes,
wounds where around the eyelids probably, or the scalp, or near the ear, where
yes.
the kids are not compliant. We already do have that. Okay, sir. Yeah.
So this glue that we were hearing about or we were looking forward to is now a possibility that will be there in our hands in the next few years. It may not be in the way that we were thinking in the past, but it is going to come. And then there will be other material like cells, which there might be cells which will enhance healing. There might be cells which will uh, help us to, um, replenish cartilage, heal cartilage, improve the viability of cartilage, create new cartilage. So these are all things which will make us completely change
Yeah.
the way we look at uh, various biological solutions, because practically we have very few biological solutions available to us. So most of our efforts at treating orthopedic patients require us to use uh, mm, implants and stuff which is not biological. So now that promise that biology uh, has held out is now going to become more and more available. Another
So
thing
I
that,
think, yes, sir. Like you are progressing. I think the two issues now in the future, or is, for example, the easily accessible material, like for example method, for example PRP, plasma rich platelet therapy, which a lot of people advocate for ailments like tennis elbow and plantar fasciitis. These are easily available, but there is not enough evidence. And the ones with which you have enough evidence, for example autologous chondrocyte implantation or the ACI,
yeah,
that they are more costly. So I think that this is the misbalance in. What do you think about this, sir?
see, right now, these are emerging or evolving technologies. And any technology which is not successful, which is another way of calling it halfway, we call it halfway technology. That means it is doing something, but it is not yet completed. That technology is usually very expensive and it is not very effective also. So in many types of material, we are halfway there. We are not completely reached there. And that is why these technologies will be more expensive. And it is a challenge to use them because only by using them they will get better. So it is a kind of chicken and egg kind of situation that unless we use the technology, we will not be able to evolve and develop it and make it more effective. And a time will come, I think that when they become successful, then the cost will go down. But it's a process that may take a little time. It is a process that may take little time. And but I can see that that is the future. It is going to happen. Another thing that has happened very, very fast is miniaturization, and transportability of diagnostic tools. Now, for example, we had this thing that an X-ray has to be taken only in a X-ray room. There's to be a machine, and that machine is heavy, and it's got this and that and all that. Now, what is going to happen is you will be able to see inside the body. You may be able to visualize bones without taking X-rays at all. I mean, you may have some different technology Like, for example, MRI is a different technology from radiology. And technologies are emerging, which will allow us perhaps to, take an X-ray at the bedside of a patient, or even take an X-ray and look at inside and look at bones or look at things without actually seeing the patient in your next to you. The patient may be remote and you will be able to see. And there are these two things, wearable technology. So as a doctor, when you go on your rounds, you will be wearing things which will allow you to do lots of things. Like, for example, when we want to know what is happening to the blood parameters of a patient, for example, his, uric acid or blood sugar or whatever. Now you see the patient will be wearing something. It's already happened. Patients are now wearing something which will give us a 24-hour graph of what has happened to his blood sugar every minute of the 24 hours. So in the same way, when you go to the patient and you just type in that I want to know 1, 2, 3, 4, 5, or if you just click on something, it will give you everything that you possibly could require as a standard module in, say, SMA 6 or 12 or 18 or whatever it is. So all this will happen instantly. It will not be like you had to wait and so on and so forth. So these are going to make our, uh, uh, titrating and, modifying our treatments much more easier, because diagnostic tools will become available. And they will be wearable, using wearable technology with the doctor as well as with the patient. So this gives a very exciting possibility of the doctor and patient not being near each other or in front of each other, and still being able to communicate. That means you can read what is happening to the patient through technology, even though the patient is sitting at a location distant from where you are. Now, you can imagine, that the entire medical practice is dependent on the patient being seen by the doctor. Okay. And even today, we are uh, told that we should never give advice to anybody unless we have seen the patient. And in fact, giving advice without seeing a patient is liable for mm, prosecution, because it is believed that if you give advice without actually seeing and examining a patient, you are doing something wrong. So now all these things will be challenged because of the rapid and use of mm, wearable technology, and also the miniaturization and the vast increase in the potential of that technology to give you information. So we will see this happening um, very, very rapidly. And just like, before we had cell phones, we never imagined that what a cell phone could do. But today, if you ask yourself whether 20 years ago, whether we knew that the cell phone of today can do whatever it is doing today, and somebody had said this is going to happen, we would not have believed it. So the evolution of this technology and its application in medical practice, diagnostic, as well as treatment is going to increase. And
Right, sir.
yeah,
Yeah, so when you mentioned about miniaturization and wearable technology, the smartwatch which we have today, which gives us detailed data of how many calories you have burned, etc.,
yes,
is a very perfect and a very, in coming years, it is going to be a very old example, or an ancient, it would turn ancient, the thing of today. So that reminds me also, again, I had gone through this talk by Sundar Pichai on how medical field is going to advance, where I don't actually remember, but there was some retina, just to mention to our viewers, there was some retina scan which you do, and based on the structure or occlusion of the ocular arteries, the chances of myocardial infarction in that particular patient could be predicted. So at this stage, we'll be ending up in the next decade probably. So when you
Yes,
mentioned about
yes. So
miniaturization, that what
yeah,
came across my mind.
yeah. So there will be various things that will happen, which will be what is known as merging of technologies, or application of one idea into another and combining two ideas at the same time, and all that will produce things that we are that will be mind boggling. But what I see at a practical level happening to the practice of surgery and practice of orthopedics is everything now is being looked at in terms of cost. Uh, all this technology is adding to the cost, and it is making treatment very expensive. Hospital stay has become more and more expensive, and it has become an issue not only in India but all over the world. Staying in a hospital is becoming more and more expensive, and the cost of good healthcare are rising. The other problem is that we would want to see how we can reduce the hospital visits, how we can reduce the amount of time the patient stays in the hospital, and how we can reduce the cost of treatment. And this is going to be a major challenge. And this is where a lot of practical applications will be. So those applications which reduce cost will become more popular. They will be adopted more. And uh, the the big problem, I mean, I know that it doesn't sound nice to say this, but the the entire uh, healthcare industry has, in a sense, uh, focused on the cost of payment to doctors and how that can be reduced, because that is something that they feel should be reduced if the patients are to be getting cheaper healthcare. Now, if that is to happen, then uh, doctors who are running smaller businesses will become, they'll find it more and more difficult to uh, be able to earn that extra cost, which makes their businesses viable. So it is possible that smaller establishments, smaller practices will close down and merge with larger practices or larger hospitals. And people who are today like proprietors or having their solo practices will become employees of a larger group, because then the cost will be able to adjust, and they will end up making the same amount of money as they would as a specialist, and not be able to meet the or have the extra cost of running their own establishments. So this is something that is already happening, and it is going to happen more and more. I don't see any way in which it will reduce. Doctors on their own are going to shift from the inpatient to the outpatient. There'll be more and more daycare treatments, because that will allow doctors to treat their patients at a lesser cost. And the whole aspect of taking care of the patient in the hospital is an expenditure that doctors will work to reduce. One other thing that I want to point out is, at least in India, and to some extent everywhere else in the world, as doctors, we tend to focus on our role in the patient care. So somebody has a fracture, he comes to you, you feel that your job is to fix the fracture, and once you have done your job, then everything else will fall in place. And the physiotherapy, the uh, outpatient evaluations, and care of the patient's problems when he is at home, and all these are responsibilities of the team. But in our practices, we don't have those teams. We are just mm, having ad hoc uh, uh, teams. So we tell the patient, okay, if you don't know any physiotherapist, I will provide you one. But now, in the future, you will be required to give what is known as a complete care. So the patient will expect the doctor to provide from the time he's seen till the time he becomes normal and goes back to work. Everything will be provided by a team which the doctor or the doctor will be part of the team. So this type of approach currently we don't have, but it will be required, and our patients will require it, our insurances will require it, and it will lead to a certain rationalization of costs, and it will benefit everyone, but most importantly, it will benefit the patient. Because right now,
Right.
a patient who is, say, poor will say, I'll get all right without physiotherapy because I can't afford physiotherapy or something like that. So all those kind of things will get more sorted out, and the the practices and doctors will have to provide comprehensive care. Like we have an insurance, we have a term comprehensive insurance, so it covers everything. So the patients will be then expecting this kind of things from us now. And another thing that we are already seeing happening is everybody is looking at everything that is expensive. So implant prices are under scrutiny. How implants are purchased and how they are provided and how the patient is charged for them is not only under scrutiny at the uh, patient care level, but also by the regulatory agencies, the government, and everybody is kind of disturbed by the fact that the prices of these uh, things are high and they are arbitrary and they are not regulated. So we are going to see a back and forth and definitely a more rationalization and more rigid controls over the prices of everything that is being used in the treatment. And there are huge problems that are going to crop up because new technologies are going to give us things which are very difficult to put a price on. Like growth factor will be available, cell transplantation, gene therapy, use of stem cells, tissue engineered products. All these, how will they be charged? How much money the patient will be expected to? Right now, these are all emerging fields. So whatever is being charged is what the market will accept. And maybe once those technologies get patents, once they get uh, kind of approvals, then the charges will go up. But at the same time, this is going to create more problems because the costs of so many things will need to be fixed. And this is going to be a real challenge for the healthcare practice and for orthopedic surgeons because we are unfortunately going to be in the thick of all these. And how the healthcare industry regulators encourage the use of these technologies by allowing better pricing and for them will determine how quickly they will mature and how quickly they will become successful. So it's because the market also is going to play a role in these things, especially with these technologies which are still evolving. I'm pretty sure that home care is going to become radically changed. Wearable technology is going to happen, and wearable technology will, as I said, involve everything from taking an X-ray to doing various blood parameters and 24-hour monitoring of the patient to let you know if the patient has pain. There could be some signals that may come to the doctor saying your patient which you operated and sent home is having a lot of pain, and that will come in the form of some, signals. Uh, that means the patient will not tell you, but the data will tell you that patient is having problem. And so the you will be able to monitor and take care of various issues relating to the patient's uh, progress and the care and the course correction that may be required in the process of care. I think that this will be a little bit of a headache for doctors in the short term, but in the long term, it will benefit the patients immensely because it will definitely improve the quality of care. It will definitely improve the outcomes, and it will uh, restore, in my opinion, the trust deficit that has evolved um, between the doctors and patients, which we will see uh, getting reduced if doctors are more involved in the comprehensively involved in the care of patients. And this is where telehealth and remote patient monitoring, because I've always felt that what is being showed and what is being uh, talked about is how diagnostics are going to improve and how diagnostics are going to get revolutionized. While that may be so in orthopedics, more than diagnostics, what I am more excited about is the patient care and the comprehensiveness of the monitoring of the devices and whatever is being used in patient care. So we are going to have more uh, improvements in all these things. And of course, uh, all this will probably mean that we'll be sailing through some stormy seas for a few years because there will be difficulties in the society accepting the increased cost of a more efficient way of delivering healthcare. The regulatory agencies will have to be, uh, everybody will have to get used to all those things. So all this is going to be something that will uh, impact on the way practice is happening.
Yes. Yes. So uh, from this segment of our talk, it is very clear that a single specialty hospital or probably it is going to be an era of multidisciplinary approach towards the patient, right? From giving the patient the rehab protocol to the diet, etc., etc. So also when it comes to wearable technologies, I think just the technology itself won't help us to go ahead. We need an infrastructure as of India is concerned, because the other day one of my friends bought an latest edition of the Apple iWatch series,
Yeah.
and he claimed that this watch predicts if I am having tachycardia or my blood pressure is raised. And I was like,
Yeah.
fine, you the watch tells you that, but what next? Do you have an
Yeah.
infrastructure where the message is passed on to the nearby hospital, and then they will take take the necessary steps?
Yes,
Yes.
I understand what you're saying. I think that, in India, we are going to have more of these kind of problems that you are talking about. But uh, all the integration and all these things will first start happening at the level of affording patient. So, like if I am a cardiologist and if I have a patient who requires monitoring of his heart more than some of the other patients, then I'm going to offer him the technology and ask him to pay the cost. So just by wearing the technology is not going to suffice. I will have to give him a monitoring mechanism for which he'll have to pay, which will detect and convey the problems to a operator or somebody who is monitoring, and it will get uh, passed on to the person who will have to interpret it and take a decision as to what needs to be done. And then that will have to be approved by someone. And then that decision can also be probably uh, executed remotely. So, but for the patient to be able to do all this, he will not only have to pay for the device, but just like we when we buy a cell phone, we also pay for the service, like a monthly charge, or depending on how much we use the data and so on. So in the same way, there will be these things will become available to, naturally they will be more expensive and be made available to those who can afford to pay for them. Um, but as time passes, they will get rationalized. See, this is the thing. When something new happens, it is generally very expensive. But as it becomes more uh, used, as the volume of its use increases, the cost also gets reduced. Um, I know that in India, we as doctors are not yet um properly, uh, motivated and educated as to how these technologies can be made more comprehensive, made more useful. But it's happening elsewhere in the world, and something that is happening and refined anywhere will become cheaper and available in other parts of the world. So it is only a matter of time when this will happen. We have discussed the use of these technologies in education and training. And I am really very, very hopeful. In fact, I'm very confident that the future of these technologies is very good in terms of the quality and the uh, you know uh, effectiveness and the efficiency of the doctors that we train and produce. Because the most difficult part, that is to learn how to do something and to do that enough times in virtual reality, till when you have to do it on a patient, you have achieved a level of competence that will allow you to deliver the outcome of your skill in a more consistent and a more predictable manner is going to happen. Uh, it is naturally going to require a certain different type of uh, teaching and learning to make this happen. Those tools are being developed and they will become more and more useful and efficient. As in the next few years, I'm just looking at 5 years in which we will not be able to recognize how you trained as a resident or as a fellow, and 5 years later, the fellow who will be trained, there will be a lot of difference. I'm very, very confident that this virtual reality is going to make the difference. Yeah.
Absolutely. And while talking about reforms in orthopedic training, Because of this statement of what you made, in 5 years down the line, there will be a complete different set of orthopedic training protocol. And I'd also mentioned that I would love to be a resident again, because if this is the quality of orthopedic training which will take place in India, it is very interesting. So
no, in fact, you know what? This is one of the things that is now being discussed very, very aggressively by all the certifying and accreditation agencies in the United States. They are saying that 5 years or every 5 or 10 years, doctors will have to retrain themselves to the satisfaction of the licensing authority. And whatever new things are coming, they will have to get accredited and certified in those things. Right now, we are just saying that somebody is certified to practice orthopedics. There is no separate certification of whether he is competent to do a joint replacement. But in the years to come, there will be more certifications in place. So if you want to practice joint replacement, you may be a young surgeon, you'll still have to certify. You may be a surgeon who's been practice for 10 years, but now wants to do this, or now wants to use a technology or a type of treatment that has become available after you passed out. You will have to undergo a minimum requirement of training, and it will be possible to do it. See, that is the beauty of virtual reality training. That, in the old days, if we wanted to learn something, we had to stop our practice, go back to the, being a resident, and that's the only way you could learn new things, or let's say acquire new psychomotor skills. But now, it's going to be possible for you to continue doing what you're doing and still acquire those skills. So I see a win-win in for new trainees as well as older people who wish to acquire new skills, or even improve, or uh, hone their skills more. All that is going to be possible.
So now that we have discussed the future of orthopedic surgery, from future of patient care to how doctors will have to modify their practices, and a very good point when you mentioned, which I was unaware of, that there is a scrutiny being taken place very aggressively on the usage of implants and procurement of the implants. And so now, what is the future for we've spoken about this a lot, but how is the research looking towards this?
This is where we are going to involve Ashok.
Obviously. And how is the research going to towards regarding these topics? And also, is there anything futuristic about measurement of patient care, actual improvement in patient care, and actual improvement in the improvement in the patient's debility?
Yeah, first of all,
because like I just mentioned an example, I have an Apple iWatch latest edition, and it predicts my tachycardia and if I'll having a minor stroke, but I don't have any infrastructure. So how useful it is actually?
See,
and where are we going ahead?
If you ask me, I don't know if what I'm saying is Ashok will agree with it, but we are going to go from the age of the bullock cart to the bullet train. So that much of improvement is going to happen because of tools and because of technology. Because in the old days, the way we measured things, the way we kept track of the changes in the measurements, the position of implants, the improvements in biology, all these things were dependent on tools which were very difficult to interpret, like we had to take x-rays, we had to compare the x-rays serially, and so on. You see, now what is happening is the technologies are going to become not only more and more wearable, but they are going to be miniaturized, and they are going to become more and more, what shall I say, uh, efficient and more specific. And I mean, like 20 years back, we 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 were just entering into the area of patient-reported outcome measures, or PROMs as they're called, as a tool for finding out how effective a particular type of treatment is. Before that, we would just measure some parameters and not really bother about patient reporting those outcomes. But now we have technologies which can digitally enhance whatever the patient is telling us and compare and match it with what we are finding with our tools. So that is a very exciting way of validating something. Like we may be using a certain technique for doing a certain operation, and we will just see the outcomes in, say, 100 patients. But now we will have the patients being able to tell us whether the outcomes were satisfactory, and other modalities and tools which will tell us the real data and compare the two. So we will be able to tell that the patients who reported good outcomes, how the data matched, and patients who were not satisfied, what were the things that were supported by data or not. So that is going to be a new exciting way of doing. And then the thing that interests me a lot is what is known as computer adaptive testing, which means that, you want to ask some questions to a patient. Now, you design a survey, and if the patient answers yes or no, then if he answers yes, then he'll get a series of questions which will automatically appear. If he says no, it will go in a different direction. So this will allow us to get more relevant responses, and the patients will have to go through a much smaller uh, amount of responses. This makes more efficient surveys and improves the quality of the surveys and improves the comparability. So they have, now for example, Cambridge University has developed a platform called Concerto, and they are working on a system for patient-reported outcome information, completely called not PROM but Promise. So these are new and exciting approaches which will completely improve the level of evidence of whatever we are studying, and we will have various types of banks, which will store those data, and therefore it will be possible to have comparable data in such huge amounts with such large number of patients that the current existing uncertainty and unprovability of various hypotheses will change, I think. So we will have, and here two things will make this change. One is the smartphones, and the other is the specialized sensors. So sensors fit into patients, or on the body, or traveling through the patient's body, will provide continuous real-time information, and they will help us to make decisions before the surgery, during the surgery, and after the surgery, which now we are having difficulties in doing it. It is taking us more time, but with these sensors and use of and evolution of these sensors to give us specific information relating to specific uh, decisions in surgeries will make a huge difference. And of course, smartphones are going to help us to uh, not only measure conveniently what is happening to the patient, but also it will simultaneously allow us to monitor the evolution of what is happening in a larger sample, in larger populations. And this automatically collected patient-specific data will give us new insights about recovery patterns and enhance pre and post intervention planning. Because right now, everything depends on whether somebody is making a special effort to study it. But with these devices, you will have a huge amount of data of all hospitals and all types of patients about what is happening to them post-operatively, for example. So the amount of data that you will get and which is possible to interpret will become much, much larger. And therefore, the value of the conclusions will be much more, uh, you know, real and much more useful. Uh, I think Ashok will be able to tell us more about this. And I hope that he'll join us and uh, take us into these areas. Welcome,
Yeah,
Ashok.
so yes, sir. So we have, I think, exhaustively covered a lot of ground and a lot of area. And especially from technology point of view, I've seen it grown over a period of years. I participated in its growth. So prompts will change to prompts, which is phone reported outcome measures. So your phone will report automatically the outcome measures to the database, which surgeon can access. This will actually not only revolutionize orthopedic surgery, but the entire rehabilitation,
Yes.
entire rehab as well as prehab.
Yeah.
Both can be, both will be revolutionized by this phone reported or DROMS. Many people call it digitally reported outcome
Yeah.
measures, where your phone or a wearable device will automatically give save your data on the cloud, which is
So for a
accessible
moment, we had lost you, and your voice is cracking.
The healthcare, and this is where the research will also progress. Research will progress in terms of, wait, am I back again?
Yes.
Can you hear
Yes.
me?
Yes, yes, yes.
Okay. Okay. So yeah, so that's what I was saying, that this will revolutionize not only the orthopedic surgery part, but the rehabilitation part also. And most of the data in research will be collected in this format. And we'll have huge databases like we have registries now.
Trauma
Yeah.
registry or
Yes, we'll have huge registries which will collect all kinds of data. So we'll be, next step will be, so currently we are focusing on or rather struggling with data collection, but in a decade or so we'll be struggling with mining this data.
Yeah.
So mining this data and getting out important insights will be the next focus of the team, of the technological teams. So yeah, that's my take on this.
Yeah. I'd like to know more about this computer adaptive testing platforms. Uh,
Yeah.
in the sense that, we have always had a lot of shortcomings in the surveys, but apparently these adaptive testing platforms will allow the improvement in the quality of information that is uh, being obtained from the surveys.
So
So
it is more, it is less of technology, it is more of insights into how the surveys. It is more advancement of the survey technology rather than the technology itself.
Okay, so this Cambridge University's open source adaptive testing platform is
Yes.
a way of making the improvements in the uh, use of adaptation to the surveys available to researchers in a
Yeah. So what? So this kind of in earlier surveys where this was ignored,
yeah
the examiners and the person creating the survey and the person taking the survey,
yeah
their adaptable ability to adapt was ignored completely. It was like a one-dimensional survey. So the survey technology in research is getting upgraded. So I mean that is what it is. That is where the computer is helping and uh, equalizing the baseline, I guess.
Another thing I wanted to ask you is, do you see the present measures that we are using, like, scores and all that, in the study of various procedures, whether there will be a uniformity or uh, a attempt to make it more comparable in some ways? Is there things that are happening in that direction?
It will definitely happen. Like I said, as more and more data comes into play, we'll
Yeah.
get more and more insights in developing these surveys. I mean, in developing these outcome scores. So surely outcome score will get refined over a period of time. Outcome scores are generally made from raw data and from a large population surveys. So once we have large data, then surely this will get upgraded.
I think
Um, yeah,
one huge opportunity that has been created by your pioneering this OrthoTV and access to a large number of orthopedic surgeons across the world is the ability to pose these questions and get opinions and get some conclusions in terms of what is the general consensus on many of these things, so that
yes,
then that can be shared with more conventional authorities like the American Orthopedic Association or European associations and so on. In the sense, because right now uh, it is a process that needs to be accelerated, and once more and more consensus is developed in terms of uniformity of scores or scoring systems, then the data will become more effective. So if I am proposing a new type of modification to a certain operation, I must also ensure that a large number of people at various places in the world will not only use whatever I'm proposing and try it out, but also use a uniform scoring mechanism, so that in the shortest possible time, the largest possible sample will become available, and the results will be more useful in terms of data. I am sure that you will be applying your mind to this, as to, because this is a challenge. I feel this is a challenge because we are. It is very easy because right now we are all working in a very disjointed manner all over the world, and somehow those efforts that I have been seeing over the last 20, 30 years have happened, but they have not led to uh, more coalitions and more uniformity. At least more needs to be done. Let's put it.
yeah, absolutely agree. And technology is already facilitating it, and it will surely, I mean, in next decade or so, we'll see a revolution in this databases and data collection. Like I said, we'll be struggling with mining the data rather than collecting it.
Right.
Yeah, but then mining. Would it not be a potential opportunity and challenge to start already developing a platform for that mining, which will be uh, developed and evolved, just like Cambridge University is trying to do something. In the same way, under your leadership in India, we should be looking at developing such platforms which are independent of any uh, uh, institutional rigidity and controls, and which are open to accepting and consensualizing the available ideas into making that platform more effective and more useful to all researchers.
Absolutely.
Because most researchers are not even aware of what you're talking at this moment about mining. I mean, this whole idea of mining is something that
I'm sure he has already taken a step forward in developing something in mining of data.
Yeah, absolutely. I mean, that is where, I mean,
see,
I'm
like
looking at personally at least.
for example, the answer to the question, how many total hip replacements took place in India in the last year, is something that only mining will give us the answer. There
Not
is
only that, it will be complete artificial intelligence that is going to mine the data. And it is how we framework the AI. In fact, AI has to learn from the data and then go back and mine it, and we'll be the interface between doing that.
In fact, the number of hip replacements done could also be accessible through the registry apps. And like you said, if added
that
AI,
kind of data mining is very simple.
Exactly.
That is not
That's what I was
mining.
telling.
That is
Now,
like
the next level mining application of AI in mining would probably give us what implant was used in what number of patients and further as well. And what
absolutely. The insights will be just churning out from the AI mining. So we don't have to manually do much. And
I mean, like on a Google page or a Facebook page, you add an hashtag and you add a word and you have n number of information about it. Similarly, in future, when you want to get some data, you use a hashtag or something in the search engine and you get immense data about it. No matter how minor the topic is or your search part is.
So an example in today's thing is about the CoWIN app.
Yeah.
It is a basic app, but it gives the live details of the things. It is also giving insights into past data, and it is to a certain extent also predicting near future.
Yes.
And even effectivity of vaccines. So a lot of things that particular app itself is doing. So it has started with collecting data. It has started with, it's also doing other things, but from the data perspective, it is doing a lot of things.
Yeah.
No, but the reason why the CoWIN app is so effective is because the regulatory body, that is the government, has made it mandatory. So right now, if you develop an extremely good app, which will be extremely good at monitoring all kinds of joint replacements, how will you make it mandatory? There will have to be a regulatory mechanism which will insist on that data being put on that platform as a requirement to be able to continue to doing the work. So these are things which will require a certain amount of advocacy from people like us who care about the use and the value of the information that is available. Because an app is just as good as how much it is used, So the CoWIN, the remarkable success of CoWIN and Aadhaar are two examples which tell us that how effective a data collection process can be and how comprehensive it can be even in a country like ours, which is so widespread, diverse, and which has so many challenges, even there, we are far ahead of many of the other countries and even advanced countries in the way that uh, decision and the implementation of these two programs that we talked about have given us the dividends, that they have given us that advantage, that edge. And more needs to be done. And I'm sure that uh, some things, we cannot expect everything to come from the regulators or the government and so on. We'll have to look at how we can not only create mechanisms, but make those mechanisms more efficient. Right now, that is a bigger challenge than creating the mechanisms to make them more widely and mandatorily being used and data being put into them. The data otherwise will be disjointed and it will be not as effective as like COVID example that you gave.
Right. For example, the data on robotics and joint replacement, the actual outcomes and the actual efficacy of robotics and joint replacement do vary from someone who is using it to market robotics in arthroplasty. So if there should be uniformity on the data as well. So it was an excellent and comprehensive, very exhaustive. And I apologize to our viewers on OrthoTV I would like to, because I should have mentioned that this talk is not just for physicians and orthopedicians, it is for IT field also, or engineering also, because we have discussed so much and so extensively, because that is the future of any field for that matter, not just orthopedics.
Yes.
So excellent talk, sir. Ashok Sham, sir, anything on the ending note?
No, I simply enjoy these discussions on Wednesday on these diverse topics, and it gets me thinking a lot about things that we discuss and also a lot of other surrounding areas. And I think that is where new ideas come into play, where that is where we try and divert the focus not only of ourselves but also of the community, that these are the areas that you can focus on and work together to make a difference. For example, I have developed the registry app maybe way back in 2013,
Yes.
the first one. It was
Yeah.
called the it was something different name, not
I was one
yeah.
of the person who was entering data into trauma registry.
Yeah,
during my
exactly.
tenure.
That was like knee registry and the supracondylar registry.
Yeah.
But before that, also I had developed something called as a ortho diary or something way back
Ortho
in
resident.
2011. Yeah, the resident one was later. The registry was the first one in 2011 itself.
Okay.
The problem was there was no culture of putting up data. So that is why I'm very happy with CoWIN and with the app, where people are voluntarily doing and putting in data so they can get value out of it. So the cultural change has been initiated where people understand that if they put in the data, they'll get something out of value from that data. So I mean, I'm looking forward to that, and that will
true, but
definitely
again,
change the registry scenario.
Yeah,
Go ahead, Karan.
No, the CoWIN, the success of CoWIN, which we just spoke about, I think it is also because people are very scared because of the pandemic, point one, and the point two being, like recently, there have been travel bans if you don't have 2 vaccines, and if you have, if you are not registered on the CoWIN app, and if you are not...
No, whatever be the reason, what I'm saying is there is a cultural shift.
Yeah, absolutely, yes.
Of people putting in data.
Yes.
And people becoming more open
See,
sharing clinical data. You have cough or fever or stuff like that. Go ahead, sir.
I can predict two things that will happen in the next 2 or 3 years. One is a health smart card, which will be just a small card which will, if you swipe it on any interface, will give you everything that is relating to your health and what has happened to you, which operations you underwent, and all the x-rays and every damn thing that was there, which will be, people will carry, and the more efficiently they have mined the data will decide the quality. And the second thing I can see happening, begging to happen, is the smart card replacing the passport, completely. And that is also something that is already talked about. And I think that the trials are already in progress. So you will just have a card which you will give, and somebody will just scan it, and everything that, including your vaccination and everything, will become automatically, interpreted, and there'll be like a green light coming and say, okay, you can just walk through if it shows green, and that's it. So right now you have to stand in a line and somebody looks at everything and scans your fingerprints and so on and so forth. So I can see that happening. What do you think, Ashok?
A lot of things are predicted and a lot of things will keep on happening. So rather than a card, you'll have a smart app which you can open on any device and you can carry.
Yes, of course. I mean, when I say card, a card is just one way of carrying data.
Exactly.
There could be other ways in which it could be made available to anybody.
Now again, the question arises that if the patient is having the smart card and if he is in some other town, some other vicinity, and if the hospital is not having the system to read the access, to have access to the card again. So I think it is more on a very larger infrastructure level.
No, it will more develop. Like we see the mobile apps culture. But the culture has developed in last. The mobile devices have developed. The data has gone cheap. The phones are cheap. People can use data as well as the phone and use all the apps. So it is a process.
Yes.
It will undergo evolution on itself to you.
So I think you will have to put a special thumbnail for today's meet for non-orthopedics as well, or for IT, including the IT and engineering. We have such amazing discussion. Yeah.
Wonderful.
Yeah. Okay, sir.
Okay.
We'll.
Thank you.
Yes, sir. Thanks a lot. Thanks for the viewers for bearing with us. We have exceeded our average